Are you an everyday woman?
Welcome back to Everyday Woman. We're talking about mammograms, and I want to know what happens during a mammogram. Dr. Kabaska, tell me about the process.
Basically, when you come in, you'll be asked to fill out a history sheet so we can find out a little bit more about your history pertaining to breast cancer risk. And then after you change from the waist up, you'll be taken into the mammography room. It's a private room, just you and the technologist, and then they will help you through the process of taking 4 pictures, 2 on each side, one where we squeeze the breast top to bottom,
Stop
and one
right
side
there.
to side.
Right there, because I just had one done. When she squeezed my breast, I told her, it's hurting. And she said she had to compress. She had to keep, why?
So squeezing the breast is what allows us to get a good picture and see through the breast. If we just took a picture of your breast on that plate that you had to put your breast on,
Right.
without squeezing it at all, we wouldn't get any information.
And then she told me to hold my breath.
For that few seconds, 2 to 3 seconds where they take the picture, we don't want any motion. Because the picture we're taking is a very detailed set of data through a digital picture through your breast. If you move, it'll be blurry. And even the movement of respiration can be just slight enough to make a little bit of blur on our
And
pictures.
do you squeeze the breast down to the same size? I mean, is Amber going to be the same size as mine?
No, everybody's different.
I know you're scared of that, but I don't know.
Nobody's squeezing these puppies.
Everybody's different in terms of how the shape of their breast is, what they can tolerate, and the technologist is trained to know what will get the best picture.
So what do you see in this picture?
So if you maybe haven't seen a mammogram on TV, it's basically the shape of the breast. We can see the outline of the breast, and then we can see through areas of what are called fatty tissue and dense tissue. It has nothing to do with weight. Everybody has both in their breast.
That's good.
And we look at the architecture looking for a growth, a lump, or something abnormal in that area.
What does a abnormal look like?
It depends on the type of breast cancer. The most common thing that we talk about is a lump in the breast. For that, we would expect to see a mass or an area
Like
maybe.
a little rock?
You could think of it that way, a little ball. And it might have irregular edges. There'll be something about it that draws our attention, that it looks different than the rest of your breast tissue.
Dr. Bremer, again, back talking about the results. When I went, there was, like a little dot. She showed my results, and there was a couple of little dots, and then they did find a lump. With the results, I'm trying to just process how, during the process, or what were you looking for, or what do those dots mean? That's what I want to ask.
I'm assuming we're talking about on the pictures of the mammogram itself?
On the pictures of the mammogram.
So just like Dr. Kabaska said, it's either a density, a mass, or some abnormality like a calcium deposit that you can see on a mammogram, that something just looks different than your normal breast tissue.
So,
does that answer your question?
Because after that, then I had to do an ultrasound.
Right. So
why did I have to do that?
Because something was seen on the mammogram, then they actually go to ultrasound after to see if they can correlate something that they saw on the mammogram with the ultrasound as well.
Now, are these results immediate? If you have a mammogram, can you read it the same day, same as an ultrasound?
Well, for my patients that come and actually see me at BreastLink, or all of our patients that are seen there, most of the time they have their mammogram on the day that they have a visit with us. So they go get their mammogram, they come over to see me after, or the surgeon after, or the oncologist, and we actually review the results with the patient on that day.
So there's nipple cancer. I'm still stuck on the nipple part, but it's nipple cancer, right? And they said the nipple is dysfunctional. So do you see the cancer inside the nipple, or does it reflect outside the nipple?
I assume that you're talking about a disease called Paget's disease, which is where you can actually have cancer of the nipple.
Yeah.
And that's usually a clinical finding, meaning you see that on a physical exam. Not necessarily do you pick that up on imaging. Possibly an MRI of the breast may pick that up. The traditional mammogram, I think you would agree, not normally pick up.
So if somebody wake up and they're like, I got 2 nipples, something's not right.
Well, usually it's the change of the nipple that you actually have. You have to
Okay.
develop a new one. You actually change, the appearance of it changes.
But you know what, Dr. Smith, the hardest part for the mammogram for me, and I think with other women, was waiting to get the mammogram and then waiting for the results. BreastLink, you get them immediately, but in some instances, you have to wait 4 to 5 days to get the results. As a doctor, how do you put a patient at ease about waiting for the anticipation of the results?
what we do, and I know a lot of centers are moving towards it, is trying to give patients reassurance the same day that your mammogram looks normal.
And what do you say?
They get a letter typically. They get notified in some way. Here at BreastLink, we have our surgeons that are also very involved with ordering the mammogram, and we'll often see the patient the same day. For a breast examination for patients that may have had prior findings on breast exams. So we give assurance to the patient or inform them one way or the other within 24 hours.
Wow. Whew. It is.
How do you feel waiting?
Right. And I'm just now hearing this. I can't believe that. Did you get your breast checked?
I did. But we'll talk about that at another time. It's a little difficult right now.
We'll be back with more Every Way Woman. Stay tuned.
Are you an everyway woman?